Welcome to our anatomy project, a model of the ear. The ear is divided into three main sections, the outer, middle, and inner ear. Throughout this video, you will see these three sections, as well as a cross-section of the cochlea, nerves of the middle ear, and various conditions and diseases that may cause hearing loss. This project has been completed by Regan McTaggart, Paige Lockhart, Caden Vanderlee, and Liv Campbell.
As we take a look at the ear anatomy, we start by recognizing the importance of the outer ear. The outer ear, also known as the auricle/pinna, helps in distinguishing between the noises originating in front of and behind the head. This is also known as the auricle localization, which is the ability to determine the source of a sound that travels behind the pinna into the ear canal. The outer ear also plays a role in the protection of the tympanic membrane from such things as foreign bodies and temperature. As we focus on the external part of the ear, it is made up of cartilage, which is coated with skin and is molded with hollows and ridges that consist of the helix, scaphoid fossa, antihelix, antitragus, tragus, concha, and lastly the triangular fossa. At the bottom of the ear is the lobe, which contains no cartilage and has no real function. Going farther in depth, the concha, which is the bowl of the pinna, is important for ear mold and custom hearing aids. Antihelix provides retention and custom hearing aids and ear molds. Antitragus provides retention and helps determine the size or feature restrictions with custom hearing aids. The crucive helix helps with retention of full shell ear mold and hearing aids. The tragus helps retention with ITCs and can hinder size of hearing aids. The pinna holds an extremely essential role in establishing the pressure differences. The air resistance is higher in the inside of the ear rather than the outside, since the inside is more condensed and under a high amount of pressure. With this function, this allows the transition of sound to become smoother, allowing sound to pass through the auditory canal without difficulties. The concha contributes by localizing high-frequency sounds, containing a resonance of 5,000 to 6,000 Hz. The concha and external auditory canal effectively enhance the intensity of sound that reaches the tympanic membrane by about 10 to 15 decibels. The ear canal starts at the conch and ends at the eardrum. The skin of the ear canal is very sensitive to pain and pressure. Under the skin, the outer one-third of the canal is cartilage, and the inner two-thirds is bone. The cartilage part of the ear cannot vibrate when an earpiece is in it. People then feel plugged, causing issues with hearing themselves. This is called occlusion. Fun fact, isthmus is the narrowest part of the canal between the first and second bend. The external auditory canal extends about 2.5 centimeters inside the skull before it ends in the tympanic membrane. The eardrum goes front and up, back and up, front and down. It also has a resonance of 2,700 Hz and also has cerumen glands, which is also known as wax. Their main function is to protect the skin, but can also be itchy and bland and dry with color when old.
Ear conditions consist of atresia, absent or abnormal narrowing of an opening or passage of the ear canal. Microtia, small pinna, usually bilateral. Anotia, absent pinna. Stenosis, narrowing of the ear canal when we lose elasticity of the ear canal. Osteoma, bony benign tumor. Exotosis, bony growth deeper in the ear canal, usually bilateral. Frequent cause is from cold water swimming. Acute otosis externa, or swimmer's ear. Outer ear canal infection, malignant diseases, cancerous growths on the pinna, usually seen in older adults from some exposure. This is also a place where we find foreign objects that can be found, like bugs or other small objects kids might have put in.
The cavity of the middle ear is a small lined membrane that separates the middle ear from the outer ear. On the lateral end is the tympanic membrane, which submits sound waves from the outer ear to the middle ear. The tympanic membrane is slightly cone-shaped structure. It contains a thickened rim around the membrane called the annulus, which fits into the bony growth called the subulus, which then connects to the canal wall. This then is able to hold the membrane into the proper space. The annulus doesn't complete a full circle around the opening of the canal wall, missing a small portion at the superior edge of the tympanic membrane. The tympanic membrane can be divided up into two portions based on the physical build. The two portions that help make up the membrane is the pars flaccid and the pars tensa. According to the Hamill and Price textbook, approximately 1/4 to 1/3 of the membrane, posterior superior area, consists of two layers of tissues and sparse fibers. Pars flaccid is the soft portion part of the membrane. This is the area where there is no annulus, thickened rim, and subulus, bony growth, attaching tympanic membrane to the canal wall. The second part of the makeup is the membrane in the pars tensa, which according to the Hamlin-Price textbook is the remaining 2/3 to 3/4 of the membrane. The pars tensa has a middle layer only consisting of full elastic fibers. This being said, that pars tensa gives more fibers to the membrane, increasing the elasticity. If you take a look into the patient's ear through the otoscope, you will be able to see that you are looking right into the ear. Be able to clearly identify the patient's shadow of malleus running downward and posterior of the eardrum. You will be able to see where the long process of the malleus attached to the most medial point of the membrane called the umbo. When you are viewing this with an otoscope, you will be able to see where the cone of light is being displayed, usually within one of the bottom quadrants of the cross-section in the tympanic membrane. A way to tell which ear you're looking at is which direction of the cone of light is being displayed. In the diagram, it is being shown as the right ear. The cone of light faces at 5 o'clock angle. When you're looking at the eardrum, you can see the long process of malleus, which is pressed against and attached to the tympanic membrane at the umbo. The malleus, also called hammer, is one of the 3 small bones that are located in the middle ear that transmits and amplifies sound through vibrations of the eardrum onto the second small bone called the incus. The 2 bones are firmly attached together, creating a lever motion as a unit. The incus, also called anvil, is the second of 3 small bones that are located inside of the middle ear. It's an anvil-shaped bone that helps send vibrations from the malleus through the incus to the stapes bone. When the incus and stapes go to connect, it can be a very fragile socket that they sit in. It can be referred to as a ball and socket movement. The stapes, also called stirrup, is the 3rd bone that is located inside the middle ear, and it is a wishbone shaped. It gives off a small rocking motion as it transmits the sound vibrations from the incus to the inner ear. At the end of the stapes, there is a footplate that extends outward onto the medial wall of the middle ear, which then is referred to as the oval window. From the vibrations of the ossicles, causing vibrations to the oval window, which then causes movement of the cochlear fluids inside the inner ear, enabling us to hear. The 2 main muscles of the middle ear are the tensor tympia and the stapes. The tensor tympia is connected to the manubrium of the malleus and is innervated by the 5th cranial nerve. The tensor tympia contracts to loud internal sounds, so for example, if you are yelling, the stapes muscles connects to the head of the stapes and is inverted by the 7th cranial nerve. The stapedius muscle is a part of the acoustics reflex, which is the muscle contraction on the neck of the stapes in response to the loud external sounds, like if someone else is yelling. The eustachian tube can be found on the anterior surface of the middle ear. It is a muscle-lined tube that connects the back of the throat with the middle ear. The eustachian tube usually stays closed but opens when you make the movements of swallowing, sneezing, or yawning. The eustachian tube serves 2 purposes. The first one is a source of air to come into the middle ear, ideally needing to have the same air pressure in your middle ear as the same as your outer ear. The second function of the eustachian tube is to be able to provide an exit point for the mucus to come out of the middle ear, usually resulting in tiny hair cells lined in the eustachian tube called ciliated, moving the muscles to your nasal wall as a way to remove the mucus.
Middle ear conditions consist of tympanosclerosis, scarring on the tympanic membrane and is a horseshoe shape, ototus meata, fluid behind the tympanic membrane, retracted tympanic membrane, otosclerosis, spongy growth on the stapes footplate, perforation on the tympanic membrane, clostrioma, benign growth behind the tympanic membrane, usually in the superior quadrant.
The inner ear can be separated into 2 systems, the vestibular system and the cochlear system. It also has 2 labyrinths. One is bony, which is there for protection and contains perilymph fluid. The other is membranous and contains endolymph fluid. The vestibular system is our balance system and helps orient ourselves in space. It is comprised of 3 semicircular canals, the superior, posterior, and the lateral. The canals and vestibule are part of the bony labyrinth, and the utricle and saccule are part of the membranous labyrinth. The cochlea is the hearing portion of the inner ear. It converts sound waves into neural signals, which are then sent to the brain via the auditory nerve. The cochlea consists of 2 3/4 turns, is wider at the base and narrow at the apex, and unravels to be 30 to 35 millimeters in length. When we look at the cross-section of the cochlea, we can see that it is divided into 3 canals, the scala vestibuli, the scala media, and the scala tympani. The scala vestibuli and scala tympani are part of the bony labyrinth and contain perilymph, whereas the scala media is part of the membranous labyrinth and contains endolymph. The scala vestibuli is the top section of the cochlea and is associated with the oval window, and the scala tympani is the bottom section of the cochlea and is associated with the round window. The two canals are connected by a small hole called the helicotrema. It causes a pushing on the oval window and creates a wave of fluid called the traveling wave that travels up the scala vestibuli to the apex of the cochlea, through the helicotrema to the scala tympani, and ends with the bulge-out of the oval window. The scala media is the middle canal and is separated by the scala vestibuli by the Reisner's membrane and separated by the scala tympani from the basilar membrane. The basilar membrane is narrow, thicker, and more stiff at the base, and wider, thinner, and less stiff at the apex. It is arranged as a tonotopic frequency map with high-frequency sounds at the base and low-frequency sounds at the apex. The scala media houses the organ of Corti, which is considered the end organ of hearing. It consists of around 3,000 to 3,500 inner hair cells in one row, and around 12,000 to 13,500 outer hair cells in 3 rows. These hair cells have stereocilia that are hair-like projections that stick out on top. On outer hair cells, they are arranged in a W pattern, whereas on the inner hair cells, they are arranged in a shallow U shape. The bottom of the hair cells attach to the basilar membrane, and the tips of the outer hair cells embed into the tectorial membrane. There are more hair cells at the base of the basilar membrane and are more densely packed than at the apex. When the traveling wave moves through the scala vestibuli and the scala tympani, it creates a vertical movement of the basilar membrane and a horizontal movement of the tectorial membrane. And this causes a shearing force between the membranes, causing the stereocilia of the outer hair cells to bend back and forth. The stereocilia have tip links and side links that connect them. When the outer hair cells bend toward the stria vascularis, a vascular strip that lies along the outer wall of the scala media, it causes the tip links to be stretched, hair cells to shrink, and ions to be released, resulting in depolarization and the auditory neurons to produce action potentials. The inner hair cells receive information from the outer hair cells and send it to the brain. The inner respond to loud sounds and are protected by myelin sheath. In contrast, the outer hair cells respond to soft sounds, sharpen the peak of the traveling wave, and are not protected by myelin sheath. Since they lack myelin sheath, the outer hair cells are more susceptible to damage. The inner hair cells are comprised mostly of afferent nerve fibers, and the outer hair cells are comprised mostly of efferent nerve fibers, both of which enter and exit the cochlea through tiny openings in the spiral lamina called the habenula perforata. When we look at this cross-section of the cochlea, the pink dot on this diagram is called the helicotrema that we mentioned previously. These nerve cells exit in groups and have cell nuclei that come together to form spiral ganglia. The nerve fibers join to form the cochlear branch of the vestibular cochlear nerve and exit the cochlea through the hollow core called the modiolus. The vestibular branch of the vestibular cochlear nerve innervates the sensory receptors in the vestibular system. Together with the cochlear branch, they exit the inner ear through the internal auditory medius in the temporal bone and begin the journey through the central auditory nervous system.
Presbycusis is the most common type of sensorineural hearing loss, and it is caused by natural aging of the auditory system. It occurs gradually and most common in high-frequency sounds. This term is referring to the outer hair cell damage in the cochlea and how the hairs are laid out from high frequencies receiving the most damage. This concludes the anatomy of the ear, made of Play-Doh. Thank you for watching.